Hello, everyone, and welcome back to the podcast. Thank you so much for joining me here today. Today's topic is one that our listeners have asked me to discuss. And today we're talking about OCD or obsessive-compulsive disorder. Many people feel occasional concern or worry about misplacing something or have a fear of germs or contamination. And some may even feel the need to arrange or order things in a particular way. But when these thoughts and behaviors become intense and begin to interfere with life, they may indicate OCD. And that's what we're talking about on today's episode. Joining me is Dr. Jesse Spiegel, a licensed clinical psychologist who treats children, adolescents, and adults. He works in private practice in Los Angeles, California, where he specializes in treating obsessive-compulsive disorder, or OCD, anxiety, insomnia, and other behavioral-related problems. In addition to utilizing CBT and exposure-based therapies, Dr. Spiegel takes a family-based approach when working with clients. I'm so excited that he's joining me here today.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, Dr. Spiegel. Welcome to the podcast.
Thank you so much for having me.
I'm really excited to have you here today because we've talked a lot about anxiety on the podcast. And, I think I was connected to you by another clinician, and we haven't spoken about OCD, and it comes up a lot. I know you work with a lot of kids who experience anxiety. It seems like we are in this stage right now where we're seeing a lot of anxiety in children and teens. Are you seeing that a lot in your practice as well?
Yes, I'd say my practice is very full with, the main thing I really do is OCD and anxiety disorders. I do work with other behavioral related issues, but it has been a lot busier. And I'd say even more so following the pandemic. And I know we've kind of moved away from it. But I would say as far as from an anxiety standpoint, we have it's probably even gripped us further, the pandemic. And then I'd say, another factor that I've seen that definitely plays a role in anxiety disorders and how they get amplified is screens, because it doesn't allow children to tolerate their emotions. And I would say adults as well, because adults are big offenders of screen time too.
Absolutely. We're definitely going to have to circle back to that because we've talked about anxiety and we've talked about screens separately, but the connection between them is really interesting to me as well. And, you mentioned OCD, obsessive compulsive disorder, and that's really what I wanted to focus on today because we haven't talked about that topic specifically. And a lot of individuals, parents, teachers have a lot of questions about it. And as someone like you who specializes in this area, I'm so glad to have you on the podcast to really explain to our listeners, first, what is obsessive compulsive disorder, OCD? Let's start there.
Sure. So obsessive compulsive disorder, you have two pieces. You have obsessions for the obsessive compulsive disorder, and then you have compulsions. Obsessions is any intrusive thought, feeling, or image that you don't want to have. It can come on suddenly, and it can be related to contamination obsessions, harm obsessions, sexually intrusive obsessions, existential obsessions. And it happens, and the person does not want it to happen. And it very much occupies this space. The second piece, which is really the piece that is very impairing for the person, the sufferer, is compulsions, which is basically anything that they are doing to get rid of the obsession. Now, it can be something that is observable, things that we could see. So, for instance, if they're checking the door repeatedly, uh, it can be asking for reassurance repeatedly. So if you have a kid and he's asking their parents basically the same question, but in various different ways. What if I were to get sick? Are you sure I won't get sick? What if this one scenario didn't happen, or did happen or didn't happen? It's basically, these are things that we can see that are observable. If you're that fly, you'd be able to see this child who has OCD asking these questions. And it can also be mental. And this is the piece that I'd say for those who don't specialize in OCD is often missing. So there may be a lot of mental compulsions where they're trying to answer that initial question that's very overwhelming to them. So it could be making lists in your head, reviewing in your head reasons you wouldn't do something, very harmful reasons you wouldn't get sick, various ways that they're trying to answer that initial question. With OCD, it is very, very impairing for the person. Now, one thing I would add to this is everyone gets intrusive thoughts from time to time, but usually they're able to just move forward from it. For someone who has OCD, it grips them, it grabs them with the kind of like the various fears being so strong and overpowering.
Right. And it seems like those thoughts and the compulsions that go with those thoughts, that cycle, it can be very time consuming when you talk about, checking or compulsive hand washing. That is what really can interfere with daily functioning for a lot of individuals who deal with those behaviors and thoughts.
Yeah. I mean, what a question that I often ask children, and when I have their parents in there for the first session, I will say, what are the various ways where you're getting stuck and it's really hard for you to be a kid, to, hang out with friends or to finish tasks, to schoolwork, to get all of the ways that's difficult for you to get along with your parents or your siblings. Essentially with that question, what I'm asking from a clinical standpoint is all the different ways that it's impairing with your functioning, whether it's academic, social, personal, and so forth.
Absolutely. And, one of the things that you mentioned, because I think when people think about OCD, they do think about like the checking the stove, checking to make sure the door is locked. Again, the compulsive hand washing. And one thing that you mentioned was that reassurance seeking, and that comes up quite a bit. And I think a lot of parents don't think about that, or maybe even some clinicians might not think about that as an OCD compulsion. And it seems like that reassurance actually feeds the OCD because you have an intrusive thought, you ask someone for reassurance, but then inevitably the OCD keeps cycling through and those thoughts come back and then you need more reassurance again.
Yeah. In OCD and anxiety terminology, we'll use something called accommodations is what the term we use. And it's various ways that others are accommodating. Now, accommodating normally has sometimes maybe a good connotation, but for this purpose, thinking of it in a way that you're not being supportive to your child, you're actually being supportive to the OCD. So you're doing your accommodating behaviors are things that you are doing differently that you would for, let's say, a child that has maybe more typical anxiety, or that you would do for someone who does not have OCD. Now suddenly, you're doing that for your kids. So an accommodating behavior could be if there's contamination obsessions, parents have to do the laundry 3 times a day. Parents aren't allowed to say certain words that could cause fear to the child. And then going back to what you were talking about as far as with the reassurance, again, this could be ways, and I will say this, clinicians who are not experienced with OCD, a child feels very overwhelmed and they want to provide that support, that relief. It makes a lot of sense. You'll be okay. You've done this before. And they continuously provide again and again that relief. Now, the challenge with it is it's not allowing the kid to learn that they can manage their own overwhelming thoughts and feelings. And then I would also say from a parent's perspective, you're not giving yourself, you're not contributing to your sense that, yes, your child can struggle and they can handle it on their own. You're more having to kind of come in and provide that clutch, which is going to be very exhausting and not help with independence in the long run.
Yes. And I can see, and I've heard from families, it can be very taxing for family members, for teachers, because it's like you can't give that child, that adolescent, that right answer enough times. Like you were saying, are you sure it's going to be okay? What time are you coming back? Are you sure you're going to come back? What if something bad happens? So again, without a good understanding of that cycle and how to kind of alleviate those thoughts that are leading to the compulsive reassurance seeking, it's really hard for parents and educators to figure out what to do.
Absolutely.
Now, OCD used to be categorized as an anxiety disorder. I think that changed in 2013, but we always talk about OCD and anxiety together. Is there an overlap? It seems like there is a relationship between
it's
the two.
Interesting. In the DSM-4, it was listed within the anxiety disorder umbrella. And then when the DSM-5, and for listeners, the DSM is the psychiatry manual of mental health disorders. And they started listing it as its own component. I would say there is definitely significant overlap, for sure. Anxiety disorders, they tend to be more, if it's generalized anxiety, it's on work, life stressors, more kind of day-to-day things, but where still the anxiety is debilitating. OCD will just go over all sorts of things. Again, whether it's fears of being contaminated, fears that you could do something harmful toward yourself or others when you don't want to. Again, going back to people with OCD, they don't want to have the obsessions versus, let's say, if someone is actually is feeling suicidal, life is difficult. It's not worth living anymore. And versus someone with OCD, it's a very foreign, they don't want that thought, but yet it's so overwhelming. As far as OCD is concerned, I mean, in some ways, I would also think of it as anxiety on steroids. It's very, very, very strong. Now, there is a lot of very effective treatment for it. There's definitely a lot of hope and a lot of ways that, with really the effective treatment, you can really see significant improvement.
And when you talk about like anxiety on steroids, it's really that intensity of those thoughts that they don't want to have, the behaviors that they don't want to perform, but feel that they need to in order to address the thoughts that they're having. And like you've been saying, it impacts so many aspects of daily functioning that can impact a child's ability to get out the door in the morning. It can infect their interaction with peers, their engagement in the classroom. It can lead to school refusal. So it can impact so many aspects of their lives, which makes it debilitating, as you've described. But it can also lead to misunderstandings regarding the reasons why a child might be behaving in that way. Why is it taking you so long to complete this task? Particularly as you were saying that some of these are internalized, these thoughts, these checking, these internal lists that they might be doing. To the observer, they may not understand what is happening because, again, a lot of these thoughts are internalized, and maybe even some of the compulsions, counting, might be internalized as well.
Absolutely. One thing, because that can be very stigmatizing for both the kid, and also it can be understandably challenging when parents are wanting their kids to get out the door and the kid keeps opening and closing the door repeatedly, and they're trying to get them to school, and now their kid's going to be late. Parents are stressed, parents are frustrated, and it makes total sense why suddenly they would lose their cool on the child, because this is exhausting. You're having to deal with this around the clock versus the clinician who comes in, has the session for, if it's once a week, and is meeting with them for 50 minutes. From a parent's perspective, my God, it's exhausting. So that makes a lot of sense. One thing that I really try to work when I work with families, we really, it's The primary treatment for OCD is exposure response prevention, abbreviated is ERP. And it's kind of within the CBT, cognitive behavioral therapy umbrella. But exposure response prevention, how the treatment works is the identified patient, the child, the adult, whoever has it, faces their fears. They're exposed to them, and they will essentially stay in it for a prolonged period of time. And often what they'll see is their fears will go down, they will decrease. Now, that doesn't necessarily always happen, but alternatively, what happens is also they learn that they can manage their fears too. So that process can be very transformative. At the same time, with this exposure response prevention, there's the response prevention piece, which is those behaviors, those compulsions that they were doing beforehand. We need to break those rules because they need to learn that they can handle whatever that fear was without washing their hands, a dozen times, or without asking for reassurance, or without playing those mental games of where they're trying to answer it. And so both pieces are very essential for the treatment to be effective.
And it seems that, with ERP, that, you're doing those sessions with the child, you're exposing the child to their fears, again, preventing the response. And because the OCD impacts the entire family unit, that you have to bring in the family as well, correct?
Yes, absolutely. So how I will address that very early on is, we'll talk about in that first session all the wonderful ways that little Johnny, is a great kid and, does so many wonderful things. Is a great brother, great sister, great son. And little Johnny is a great student. Really try to identify all these wonderful traits that little Johnny has. And little Johnny has also OCD. And
right.
OCD is, again, getting in the way of little Johnny being a kid. Not only that, OCD is making it difficult for little Johnny, and it's also making it difficult for Johnny's parents. Now, what I'm trying to do here is I'm trying to externalize OCD from the child. And also this is meant for the parents too. So as we identify these behaviors, little Johnny is still little Johnny. And little Johnny also has OCD, that we're going to need to learn new ways to respond for both little Johnny so that, and I don't know why I chose little Johnny here, but so Johnny can still continue being a kid while we are learning to fight back against these fears. And then also for parents too, it's going to help allow for communication. So they're not, in those times when they're getting really frustrated and so forth, they're able to still see their kid for who their kid is versus being able to externalize their frustration on OCD. And also though, just learning to respond differently.
Absolutely. I mean, the two things that are striking to me in terms of what you just said is that one, to really highlight and help parents to recognize their child's strengths, because when you're in it and you're having that trouble day in and day out, getting out the door, it's easy to kind of focus on what's not going well, right? What's not working in the home. But recognizing their child's strengths and the child's willingness to work hard to overcome challenges is such an important piece. And at the same time, involving the parents in the treatment plan, because they are going to need to know ways to respond to their child in a helpful way. They're going to need to know how to not be accommodating and be more understanding. It seems that you help them with that as well.
Yeah. I'd say often two approaches that parents will take is usually being overly accommodating, where suddenly, they're not allowing their child to feel any anxiety or from the OCD, any distress, or alternatively, it's being very demanding. Come on, you got to do this. Every other kid does this. What's wrong with you? You got to get your act together. And the reality is there is something kind of called being supportive, where you're, I know this is difficult and I believe you can handle it. And so in kind of that language choice, it's recognizing the child's own ability to manage their own distress while not filling in for it. And you're being supportive in the process.
Right. Right. And it seems like that work with parents combined with ERP really helps teens feel more empowered and confident in learning new ways to respond to their OCD.
Everyone is part of this treatment process. It's not just the child who is the problem. It's the parents need to learn new ways to respond, because actually the parents don't realize this, but they actually too are contributing towards OCD getting stronger. So now parents are going to learn new ways so that they're best supporting their kid and not OCD. And maybe that means, if a child, asks repeated questions that they can answer, I'm wondering if I'm helping you or if I'm helping OCD right now. I really want to help you. And I'm not sure if me answering that question is going to be helpful towards you. And I really want to be helpful towards you right now.
That's really great. And I think in the moment, sometimes parents, they want to alleviate their child's anxiety, which is human nature, to like, who wants their child to feel distress, right? You want to alleviate that distress. And, parents also need to learn new skills, just like students, children, and adolescents who are dealing with OCD need to learn new skills to manage their OCD. And one thing that been thinking about when I was kind of reading through the work that you do, you talk about the worry monster concept. Can you talk about that?
Sure. And I will tell you what the worry monster concept, when I meet with parents, when I meet with them and there's younger kids, usually there's a lot more of a buy-in right away with the worry monster. Like, oh yeah, it sounds great. Because, it sounds a little silly, the term.
Right.
And I do use this concept with adolescents and even sometimes with adults too, but I will describe it in a way that works with all parties.
Yes.
With kid clients, essentially what it's saying is, as I was talking about, you are you. This is the reality. You are this wonderful kid, or if you're an adult and you have OCD, you do so many wonderful things. You work very hard. You are a loving partner. And you have this OCD. And essentially with the worry monster, we're going to externalize it and we're going to give a name to it. Now, the term worry monster is kind of like a broad, generic term, but whatever it is, let's give a name for OCD. So, in cases of like a just right OCD, where you need to do things until you get this right feeling versus necessarily having like an specific intrusive thought. So let's give a name for this worry monster. Let's give a name for the OCD. And then maybe the kid is a big Harry Potter fan. And the kid's like, let's name it Voldemort, an example. So we're going to talk about all the ways that Voldemort causes you to participate with your OCD. So maybe in that just right, whenever I get an uncomfortable feeling in my head, I touch the right side of my head 3 times. Or if I tap my finger twice, now it's uneven. I need to tap it 3 times on my right side, or whatever it is where they're trying to get evenness. But essentially, we're going to look at all the specific behaviors, all the specific compulsions that the child is doing. And likewise, and this is where there's the parent involvement too, we're looking at all the ways that parents are participating with the OCD. So maybe it's all the ways when child says, am I going to be all right? Parent answers yes, and also does that 20 times. And so this is essentially going to create a massive list of what is going on. And it's also what's maintaining the difficulties. And from this, it's going to provide a whole avenue as far as with exposures and how to face the fears, and also how to break the current rules for both parents and for child. And by the way, I should say also, when I was talking about with the younger kids and the worry monster, for adolescents, one thing I'll be like, I won't use the term necessarily a worry monster, but what I'll say is, you have a lot of wonderful traits, and it seems like you also have OCD. Do you want to give a name for OCD? And some of them will say, sure, yeah, let's call OCD, stinky pants, or whatever name that they want to call it. Something that's essentially, can be lighthearted or something they don't like. It's meant to take away the power from OCD. That's the benefit of it. So some people just prefer to call it OCD, which is totally fine.
Right. And so by doing that, it's kind of like that kind of name it to tame it. You're externalizing it. It's not who you are, but it's impacting the way you kind of interact with your world. And then I'm going to give you skills to be able to kind of address that worry monster, Voldemort, Freddy, whatever you want to call it, right? Or OCD.
It's exactly. I will tell you, I've had some very interesting and funny names that kids have come up. That gives a good laugh, and it also just really makes it a lot easier for everyone.
Right. And so when kids go through therapy and you're working with parents, what kind of outcomes can parents expect? I know it's going to look different for different kids because sometimes it's not just OCD. It might be OCD with a generalized anxiety or with ADHD. What are the expectations in terms of, length of treatment, alleviation of symptoms? What could that look like?
It varies, is what I would say. When I work, because it really varies as far as we have to take into account a lot of the times kids don't want to be in treatment. They don't want to have therapy. So we want to, in those cases, we're going to need to find motivating factors of why they want to do this work. Now, with OCD can sometimes be fairly debilitating that the kid just wants to have a good quality life and feel like they're kind of like other kids that they see. In which case that can actually be a very big motivating factor. It can be complicated if there's any other presentation, whether it's autism, ADHD, if there's depression. As far as treatment length, it's interesting. Sometimes I can have a kid where they are impaired and they're basically doing compulsions for about at least 4 hours a day, and we'll start working together. And within like a month and a half, 2 months, suddenly from the compulsions, it's like only limiting them for a half hour of their day. It can be really the treatment with the exposure response prevention can be quite dramatic. As far as kind of an expectation is concerned, when making that initial list, the worry monster rules and all the ways that the compulsions are coming up, you want to start making some inroads in that, where the compulsions are really occupying a lot less of the time. And the kid is essentially able to have whatever thought comes up, whatever feeling, and move on. And that's really how I evaluate their improvement and their sense with the treatment that it's going in the right direction. From an exact treatment like that, it can vary from case to case.
Right. And that's true with all types of treatments. It depends on the severity. It depends on if there are co-occurring issues. It depends how many sessions are missed. All of those things, the extent to which parents are involved. But I think the big picture is that there is a treatment for OCD. There are treatment options. There are evidence-based approaches. And it's really important if educators are seeing some of these behaviors that are interfering with a child's ability to connect with peers, engage in the classroom, interact with family members, impacting the home environment, that there are treatment options and licensed clinicians like yourself who can help.
Yep, absolutely.
Dr. Spiegel, I can't thank you enough for being here today. This is a topic that I've wanted to discuss for a while. I get questions about it all the time, and you've really provided valuable information about not only what OCD is, but how it impacts young people, how it can impact the family, and how it's treated. If our listeners want to reach out to you to learn more, what is the best way for them to get in touch with you?
Oh, thank you. And I want to say I've also really enjoyed being a guest on your podcast and getting to talk with you. As far as the best way to reach me, my contact information is all listed on my website, which is www.drjessespiegel.com. So that's DR and then my first name and last name.com. and hopefully no one misspells my last name.
We will put it in the show notes. It will be in the show notes with a hyperlink to make it easy.
For that.
Wonderful. Thank you so much again for being here. I appreciate you and all the work you're doing.
Thank you so much.
I hope that you will reach out to Dr. Spiegel. His information is in the show notes. He also has a number of resources for OCD on his website. If you have enjoyed this episode and others, I hope that you will sign up for our newsletter. There you will get insights, strategies, and event updates designed to support kids and teens just like yours. Valuable information to nurture your child's potential and well-being, and to give you the tools and knowledge needed to help your children thrive. You can sign up at childnexus.com. Thanks again for listening.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.